Welcome to the class on acquired disabilities, rehabilitation models and issues. This PowerPoint was created by Frank McDonald and adjusted for this class. You can find it online at the website link. What is acquired disability? It is an ongoing or permanent condition a person has received as a result of illness or accident later in life. So people are not born with that. They get it later in life. The condition may be stable or progressive, usually worsening. There are several types of disabilities and also acquired disabilities. They can be intellectual or learning, medical, physical, psychosocial, neurological, or communication. Acquired disabilities have some impact. The widest one is the physical impact on a person, then social and occupational impact, less psychological impact, and even less spiritual and existential impact. People with acquired disabilities have usually some adjustment problems. At a physical level, they are unable to cope with functional aspects of disability, loss of control of basic physical functions, pain, or health changes. At the social level, they might have difficulty with losing activities that give sense of pleasure, identity, and achievement, finding new ones, and coping with changed relationships with family, friends, and sexual partners, loneliness, and isolation. At the occupational level, they might have difficulty revising educational and career plans or finding new jobs. At the emotional level, they may have high levels of denial, anxiety, grief, depression, aggression against staff or against people. At the motivational level, they might fail to comply with therapist or self-management. Also, there is a loss of initiation of new things. Self-concept is also affected. They might be unable to accept changed body image, self-esteem, or levels of competence. And finally, at the existential or spiritual level, they might not be able to have meaning of life, and without sense of meaning and purpose, acquired disabilities can be an unbearable burden. When usually source is threatened or diminished, why go on? Questions arise. The next couple of slides are on adjusting because that is the hardest part of any acquired disabilities. Usually, initial reactions include a mixture of anxiety and depressed mood. People are worried and uncertain about ability to cope with changes. Usually high. This is usually high in early stages, and also has some short bursts. Diagnosis of newly acquired disabilities or illnesses can produce shock and denial. Denial and other avoidance strategies can be useful to help absorb the shock, however. Initial reactions also include a depressed mood. Some people say that it peaks shortly after diagnosis, and others say that it peaks when they realize full extent of their disability and after many frustrating experiences. This can take more than a year to fully emerge. Common emotional reactions to acquired disability are confusion, denial, disbelief, anxiety, fear of losing control, panic, inadequacy, humiliation, anger and frustration, resentment, sadness and crying, guilt, helplessness, hopelessness and despair, disorganization, fatigue and lethargy, loss of interest, withdrawal, loneliness, isolation, and abandonment. People have to cope with acquired disabilities, and here are some strategies that are used by people who manage in the face of chronic illness. Distancing is one of them. They try to detach from stress of situation. Positive focus is another one. They try to see the positives in their situation and find meaning, for example, in personal growth. Seeking out social support is another strategy. They try to have skills, access, and receive encouragement to do so. If that is done in ways that don't drive people away, connecting with family, friends, and organizations can result in people living longer, adjusting more positively and quickly, and improving health habits, and also using health services appropriately. Denial is used sparingly in early stages. Another coping strategy is problem-solving focus on aspects of illness amenable to change. Emotion-focused coping techniques are another strategy. Uh, for example, calming strategies for aspects that can be controlled, and also flexible use of coping strategies when people are trying to change things that they can change and accept the things that they cannot. People who are open to self-management also cope better. Self-management view of illness complements efforts of doctors, therapists, and carers. When it happens when people say things like, "It's not my fault that this happened to me. Factors outside my control led to this illness, but I do have a responsibility to help in my rehabilitation and care. As challenging as that will be, I can exert some control over the effects of this illness." When people do not cope, you may notice some warning signs when people have trouble coping. These are, for example, lots of escape fantasies or wishful magical thinking, avoidance efforts when people are overreacting, overdrinking, excessively smoking, overusing medication. Also, lots of self-blame, helplessness, or anger and blaming others. Passive acceptance is another sign when people have trouble coping. Passive acceptance of when or forgetting illness, fatalistic views of illness, withdrawal from others, inability to access supportive networks in community as adjustment problems arise, and also unhelpful schemas about health when people say no pain means no problem, no need to get blood pressure checked, for example. This table shows stages in evolution of family reactions to brain injured member. It has time since hospitalization from 0 to 3 months, 3 to 6, 6 to 9, 9 to 12, 12, 15, and then 18 to 24 months or later. It shows perceptions of patient by family when a patient may be tired first, weak, and then not really cooperating, non-motivated, self-centered, irresponsible, lazy, and then they might start behaving like a child and like a very dependent person and difficult person. The expectation to recover and get better is usually better during the first few stages. If that is missed and it takes more than 6 months and the patient is not really adjusting and coping, then they might be very low chance to recover and accept the disability. Family reactions vary from being happy about, let's say, that a person survived an accident to being anxious, angry, discouraged, guilty, depressed, and also then mourning and emotionally and physically disengaged. There are some empirical predictors of poor adjustment prior to disability, and these include previous treatment failures, psychopathology and personality disorders, dependency traits, depression, emotional immaturity, increased reinforcement of illness versus wellness, absence of social support from significant others, anger or resentment, fear of failure, loss of self-efficacy and self-esteem, external locus of control, fear of pain. There are other factors that affect psychological adjustment, and these are pain, medication, isolation, boredom, medical complications and body image, cognitive problems, TBI, family, friends, and social support, and visible versus non-visible acquired disability. Some mental health issues are also associated with acquired disability, and these can be depression, anxiety, including PTSD, adjustment disorder, substance use, denial of deficits, social withdrawal and unmotivational states, and also behavior disorders. I would like to finish this presentation with 3 images that I added to the PowerPoint, and these present Kübler-Ross model of grief. Elizabeth Kubler-Ross was Australian psychologist who described stages of people terminally ill, 5 stages of pretty much dying. She first identified that people are in shock when they say things like, "I'm surprised that um, this happened to me and that I survived." Then they deny the situation. They say that they don't want. They they deny that they are terminally ill. They say that they might survive and that it's not true, that the doctors are wrong, and so on. The next stage is frustration and anger. When they are frustrated with realizing that it is true that they have that illness or disability. The next stage is depression, which is the worst, and it might take from several hours to several years to be in the depressed stage of illness, when people are really worried and are not motivated to do anything. And then slowly they start experimenting, trying to see if they can get better and what may happen, and finally they are able to accept their illness and disability, and they get a new mindset, which is positive. They try to make decisions and they look forward to things that are really in the nearest future. Some people may never get to the acceptance stage, and for some people it is much shorter. It may take about a year to get to the acceptance stage. Here's another picture of it that shows the 5 stages. And finally, here's an illustration of it. The denial picture first shows a person in rain when the person says it will be a quick recovery, so they're pretty much denying the illness. Then they get angry because they are not recovering, and they think my plans are ruined, and they're very angry with everything and everyone around them. Then they start bargaining. When experimenting kind of in bargaining, they are trying to say, okay, if I do this, this will happen. And they try to make some promises and some goals, but it's not working for them, so they get into a depressed stage. And finally, slowly, they try to accept things. What helps with the acceptance is to look forward to events that are in a very, very nearby future, and not have any long-term plans because they might not happen. And then they try to enjoy everyday events such as birthday celebrations and play of children that they watch, and just little things that keep them happy and alive. Some people also may try to commit suicide when they have acquired disabilities. It usually happens during the depression or anger stage. They might start abusing alcohol and other drugs. They might develop some psychiatric illnesses and really attempt suicide. They might be at higher risk if they are male, if they have chronic pain, if they have multiple medical problems, if they are isolated, if they may have schizophrenia in addition to their acquired disability, if they're expressing hopelessness, and also if they may have family disintegration. So this is an overview of acquired disabilities. Very difficult thing to adjust, but as some videos will show this week, you will see some stories of people who in fact adjusted very happily and enjoy their lives in spite of losing all 4 limbs and so on. So have a good reading and discussion this week.